Second white coat. Subscribe and like. Let's learn medicine together.
Today, we're going to be medical detectives working on a pretty complex case. A 65-year-old accountant, a guy whose sharp mind is, well, suddenly failing him. And his own words give us our very first clue. So these are the patient's own words, and man, they get right to the heart of the mystery. For someone whose entire career was built on planning and organization, this is a massive red flag. You know, this isn't just a bad week at the office. This is a fundamental, scary change. All right, let's take a look at the case file. What we have here is a previously high-functioning professional who's going through a really rapid decline over just 6 months. He's making mistakes at work he would never have made before, and the trouble follows him home. His wife's had to take over the finances, and even something like preparing a meal has become a huge struggle. So what on earth is going on here? So, how do we crack this thing? Well, just like any good detective, we follow the evidence. And the physician's examination turned up some absolutely critical clues. The investigation reveals 5, count 'em, 5 telltale clues. First, the timeline is abrupt. We're talking months, not years. Second, the main problem is what we call executive dysfunction, which is exactly that trouble with planning he mentioned. Then, we see focal neurologic findings, basically problems that are specific to one side of his body. Add in an unsteady walk and a major underlying risk factor. Let's look a little closer at those physical signs because they're really interesting. The physical exam gives us a huge clue. The problem is totally one-sided. While his right side has normal strength and reflexes, his left side is showing weakness and these overly reactive or brisk reflexes. This asymmetry is a BFD. It tells us the damage isn't just spread evenly across the brain, it's localized, hitting specific areas. And here it is. This is maybe the single most important clue in the entire case. This blood pressure reading, it's really high. And since he hasn't been to a doctor in years, it's pretty likely this isn't a new thing. This is a sign of chronic, untreated hypertension, and as we're about to see, it's the key that unlocks this whole mystery. Okay, so let's just recap for a second. We've got an abrupt decline, major problems with planning, weakness on one side of the body, and a long history of high blood pressure. So what condition fits this very specific pattern of evidence perfectly? Yup, all the evidence points to one diagnosis, vascular dementia. And this is a big one. It's actually the second most common form of dementia, right after Alzheimer's. But it's not caused by the plaques and tangles you hear about with Alzheimer's. Nope, this is caused by problems with blood flow, specifically damage to the brain's tiniest blood vessels from that long-term high blood pressure. So what exactly is vascular dementia? The easiest way to think about it is like a plumbing problem in the brain. It's a decline in your thinking skills that's caused by conditions that block or reduce blood flow, which basically starves parts of the brain of the oxygen and nutrients they desperately need. And that lack of blood flow, well, it leads to brain damage. Okay, so let's follow the trail of our main suspect here, that chronic high blood pressure. How exactly does it create this plumbing problem and end up injuring the brain? It's really this slow, damaging chain reaction. You see, years and years of high blood pressure just punish the tiny arteries deep inside the brain. It forces their walls to get thicker and harder. And as those walls thicken up, the channel where the blood flows, it's called the lumen, it gets narrower and narrower and narrower. Eventually, the flow is so restricted that it causes these tiny areas of brain damage, almost like a series of silent mini-strokes. And this damage isn't just random. It specifically targets the deep wiring of the brain, what we call the frontal subcortical circuits. Think of these as the superhighways that manage all our high-level thinking, like planning and organizing, and also coordinate our movement. The damage creates all these little roadblocks all over these critical networks. And this is the key. This is the aha moment. The location of the damage perfectly maps to the patient's symptoms. Damage to the planning circuits, boom, executive dysfunction. Damage to the motor circuits, you get an unsteady walk. And because these little mini strokes are scattered around, you get that one-sided weakness. It all just fits. But you know, a good detective always has to rule out the other usual suspects. So why are we so sure this isn't Alzheimer's or maybe even Parkinson's? This table right here makes the distinction crystal clear. Alzheimer's usually starts gradually, with memory loss, right? Not abruptly with planning problems. Parkinson's dementia comes after years of very distinct motor symptoms like tremors and rigidity. Our patient's profile, that abrupt onset, their early executive dysfunction, and the asymmetric motor signs, it's a classic match for vascular dementia, and honestly, a really poor match for the others. We can also confidently cross a few other conditions off our list. Things like Wernicke's encephalopathy, which is linked to malnutrition, or diffuse axonal injury, which is caused by a major head trauma, they just don't fit our patient's history at all. The evidence simply isn't there to support them. So, we've cracked the case. What is the one-liner takeaway from this whole investigation? The single most important lesson? Here it is. This is the signature. When you see a patient with early and really severe problems with planning, combined with a sudden or stepwise decline in those specific one-sided neurologic signs, you have to think about vascular dementia. It's a very distinct clinical picture, and it's driven, most often, by damage from high blood pressure. And that leaves us with a final, really powerful question to consider. This whole case is a pretty stark reminder that something as common as blood pressure isn't just about your heart health. It's profoundly connected to your brain health. It really makes you wonder, what other everyday health metrics are playing a silent but absolutely crucial role in shaping our cognitive future?